Hello, everyone, and welcome to the Aging Games. Today, I have such a treat for you ladies, especially if menopausal symptoms have been driving you crazy lately. You know, the hot flashes, can't sleep, staying up all night, anxiety, you're like, clawing your eyes out because you're so frustrated, brain fog. Should I go on? I mean, you guys know what I mean. So today, I'll be interviewing Dr. Stillman. Now, I met Dr. Stillman through the Institute of Applied Quantum Biology, where I've been studying quantum biology, and his lectures have been mind-blowing. This guy is so knowledgeable. I've learned so much from him. So I literally begged him to come on and have a chat with me on the Aging Game so he can share his wisdom and his knowledge with you guys. And I was so excited to pick his brain and get a whole different perspective on menopause and how to manage these symptoms and how to deal with all the craziness naturally. So, guys, let's have a look and see what Dr. Stillman has to say. Dr. Stillman, thank you so much for being here. I am so excited to pick your brain about hormones. My audience is ladies over 50, so we are dealing with a lot of issues, hormones all over the place, menopause, perimenopause. Please help us. Where do we start?
Thank you for having me. Yeah. So I think the biggest message that I have for women who are, and who isn't, right? Looking to live as long as possible, looking and feeling as good as possible, is that the most important thing is to really embrace nature. That's sometimes uncomfortable. It can be cold. It can be hot. It can be sweaty. It can be dirty. But the reality is that the women who age the most gracefully have exposure to nature. It doesn't have to be miserable. I'm not telling you have to go out and buy a cold plunge and use it when it's 10 degrees outside. But I do see that as being the foundation and the bedrock of health. And there's so much more that we could talk about on that. I mean, we could talk for hours about that. But that's the biggest lever to move. Beyond that, what I see happening is that women are, unfortunately, being marketed a lot of products that really over time tend to undermine their well-being, right? Everything from plastic bottled water, which, when I'm traveling and I'm in the airport, I buy bottled water too. So we have to a certain degree, deal with the fact that there's going to be plastic in our lives. There's going to be heavy metals like aluminum, but minimizing our exposure to those things. And I was reading an interesting book this morning about GHK copper peptide, which we'll talk more about in a moment, where he was talking about the fact that something like 2.2 kilos or 4.5 pounds or something like that of what women put on their skin every year is absorbed into their bodies.
That's insane.
That is a very sobering thought when you realize that, if that's happening every year, how much of that is being excreted? And if you're accumulating these things, and that's the thing I see in my practice overwhelmingly, is that women, as they age, they've accumulated toxins.
Mm-hmm.
And those accumulated toxins take a toll on the system. And then there's all these stresses of modern life. There's sound pollution and light pollution and EMF pollution. And there's stress like your phone going off. And there's just so much stress, so much more than we were really optimized for prior to the modern age, that the more toxins women have on board, the less resilient they become. And so focusing on having a life where you're in nature, you're doing things to detoxify your body, which I'm sure you teach your people about all the time, and then picking and choosing products that are going to help them, cope with stress and become more resilient without undermining their physiology with toxins is really critical. And I'm not the
Would the
yes.
first step be detoxing the body? So if somebody comes to you and they're presenting with all these different problems
Mhm.
and different symptoms of menopause, would the
Yes.
first step that you do with them, would it be a detoxification program?
Well, oftentimes, yes. But
Mhm.
what I also find is that usually what is really going on is a combination of nutritional deficiencies and toxic exposures and overload. And so the thing is, what people don't realize is that if you don't have the nutrients on board necessary for life, you don't have the nutrients on board necessary for detoxification. And that's where I see a lot of people who don't properly nourish themselves getting into trouble when they try to detox because the body can't handle the stress. And detoxification is a stress. It's a stress that's supposed to make us stronger, but it's still a stress. And people just don't learn all these little ins and outs of how do you optimally nourish your body? How do you maintain your mineral levels, your vitamin levels, your methylation status, all these things. That's something I work with patients one-on-one, to tailor their supplement protocols and my recommendations to them. But there's a lot of things that people just need to do on a day in, day out basis in order to keep themselves well nourished and keep toxins flowing out of their bodies.
So it's redox before detox, right?
Yes, it's a great way to look at it. Yes.
Yeah, that's very important. And now, as far as diet, what is the most important thing once we're reaching 50? I always say protein. I'm always prioritize protein, make that the staple of every single meal. What is your recommendation to women normally?
One of the biggest mistakes that I see women making is not getting enough vegetables
Mhm.
and specifically root vegetables. And
Oh,
the reason
really?
why I see this as being so important is that I've noticed that women and men, as they get older, they eat less because their caloric needs drop. And they're also tempted by convenience to eat more grains. Grains tend to actually be quite low in potassium, as well as many other trace elements. Some grains are exceptions to this, but that's by and large the case. Grains are fantastic if you're trying to fuel young athletes with high metabolic rates and incredibly efficient physiology thanks to their youth. But what I've observed is that as people get older, they need higher quantities of cooked vegetables and particularly root vegetables. And the root vegetables are important for two reasons. Number one is the fiber that they have more than grains. And then the second is their potassium density. So they're much more dense in terms of their potassium content than most vegetables. And even though people might take a vitamin mineral supplement protocol that depletes their needs, rarely, if ever, do they include potassium in those protocols. And so I often find that women are very low in potassium. I had a young lady, not particularly old. She was, I think, in her early 40s, and she ended up starting the protocol I recommend, which is called my 14-day reset, which people can learn more about if they want at my Substack blog. And one of the things is to eat root vegetables and vegetables. And she started to do that. And sure enough, even though she was eating more carbs, she started to lose weight and have more energy. And the reason why is she was suddenly getting this potassium back into her system.
Very interesting. And if somebody, for example, they didn't want to eat the root vegetables, can they supplement with potassium instead? Would you recommend that?
It's possible. Yes. I can't say it's going to be the same, but with potassium, what people may not realize is that number one, it's bound in food, and that's a good thing because if potassium fluxes too quickly into our systems, it's actually fatal. It's one of the ways that they have historically killed people by lethal injection. Now, I don't want that to scare anyone because potassium is also a vital nutrient, and if you don't get enough of it, you are sure to develop all kinds of chronic diseases. I mean, I remember reading a very interesting book about low potassium levels, and it showed that in pretty much every model, if potassium intake drops below a certain threshold, pretty much every chronic disease you can imagine will appear. And that the hunter-gatherer diets that have proven to be most helpful for preventing disease have an intake somewhere between 5 and 8 grams, and the average American gets 2,500. So here's the thing with potassium supplementation. And the reason I mention all that is that if someone's got impaired kidney function, which is not that common, but also not exceedingly rare, and they have too much potassium, it can overwhelm their ability to excrete it, and that can create some problems. And by which I mean it can send them to the ER, the ICU, they can have cardiac arrhythmias, it can be fatal. So if someone has impaired kidney function, they can't supplement potassium, as far as I'm concerned, unless they're being very closely monitored by a physician. That being said, if you're going to supplement potassium, you have to understand that the average potassium supplement has about 100 milligrams of potassium. And if you were going to take a gram of potassium, which would be a significant dose, you would have to take 10 of those. So people don't realize that if they say, well, I want to make up a 2-gram deficit of potassium, which we commonly see in people's diets, they would have to take 20 capsules of potassium over the course of the day. This has led me to supplement people with potassium chloride as a salt rather than using potassium chloride capsules. But potassium chloride has a pretty strong taste. And, you're still looking at taking like a teaspoon quantity of it. It's a big volume. So people eat the root vegetables almost all the time.
What's your take, Dr. Stillman, on HRT, BHRT? Is it something that you recommend to your patients?
Yes, we offer it to patients,
Mhm.
and it really comes down to what their goals are. because, the reality is the safety is very well established. Where people have had concerns in the past about the safety, all of those studies were done with fake synthetic hormones, and or they were done in people who were not well at baseline, had really not taken good care of themselves. And there is an issue with BHRT where for a certain period of time, if you've been off of it, you do have an increased risk of plaque rupture in your arteries. This is counterbalanced by the fact that long-term, the risk reduction is significant, much more significant than any drug we have that's synthetic. But A, it has to be appropriately monitored by a clinician. B, it has to be the bioidentical form, so it can't be some fake, medroxyprogesterone acetate made by some pharmaceutical company, right? And then you have to use the right dose in the right patient. And so I have patients who are on it. I have patients who are not on it. I don't, I don't tell them they have to be on it. I give them the option. And I really don't I see many other approaches synergizing with that, which we'll talk more about. But I do see that the bioidentical hormones are the single most consistent thing. Now, that doesn't mean they're right for everyone. And it also doesn't mean that, because the other thing I've been amazed by with HRT is so many people have adverse effects. They try thyroid hormone and they feel worse when they should feel better. They try estrogen and they get paradoxically worse hot flashes than better. They try progesterone and it makes them feel worse. That I've concluded is related to their total toxic burden. And the hormones are doing things like upregulating pathways that the body can't run because the body doesn't have the proper nutrition or has a total toxic burden that is being basically released from cells when we introduce the hormones. And so that's been a very interesting area of my practice where we're trying to help women who can't take hormones, but who have hormonal problems.
So what is another option for them? What's something else that they can try instead?
Well, the number one thing that I recommend to women who are struggling with their hormones and who want to age as gracefully as possible is light therapy. And specifically, as you and I've talked about before, the X39 patch from LifeWave. LifeWave is a company that's been around for more than 20 years. It's my favorite product. The X39 patch specifically is my favorite product from them. And what it does is it is carefully engineered by the inventor David Schmidt to reflect light from the body. So your body's emitting light, and this patch, which I can show you, this is how it comes in the mail. So it's a sleeve of these patches, and you peel the back of it off and you just put it on your skin. You can,
Right here.
you can show people, on your back of your neck. And what happens is the back of the patch that's on your skin has this organic matrix on it. It's just amino acids, sugars, it's all natural. That reflects specific frequencies of light back into the body at very, very, very low doses. What's amazing about this is that even at those low doses, it actually has these profound effects on the body. And one of these is increasing production of GHKCU or GHK copper peptides. So peptides, if you haven't heard about them, you're going to hear more about them. They are one of the most powerful tools for anti-aging medicine today. They've been getting more and more popular as time has gone on. And I'm seeing them explode right now because people are getting older and people don't want to get older. They want to live well and look good. And we've never had more of a capacity to produce these at scale. And so now we've got international supply chains where you can get peptides anywhere.
Normally, peptides are being injected, right? Normally,
yes, most peptides are injectable.
Injectable.
Some have oral forms, which are not particularly effective because they're being digested by the body, obviously. So most peptides are injected, and I have mixed feelings about the injectable peptides. It's not that I see anything wrong with them, but there's a couple things that I know about patients. The majority of patients are needle phobic. They will never inject a medication. They may change their mind if the medication is needed to save their life, like diabetics. But the reality is most people are very resistant to that, and I understand why. I personally don't particularly feel like injecting myself either.
Yeah.
So peptides are mostly injectable. The oral forms are more or less bioavailable. But here's the thing about GHK copper peptide that I love. It's upregulated by the X39 patch in a significant way. And what this does for my patients, their hair, their skin, their nails. I just had a call with a woman the other day who started these patches probably 2 or 3 weeks ago. And her hairdresser said, "What are you doing differently? Your hair is so much thicker. It's so much stronger. Is this a new product you're using?" She said, "Yes. I've been using this other nutritional product for months. It hadn't given me these results. I started this new product." And the hairdresser said, "You've got to get me this product. I've got to recommend it to all my clients." And these are the kinds of stories that I get. And I've had patients tell me that their massive surgical scars have disappeared with this project or product.
Wow.
I've had them tell me their fine lines, their wrinkles, their sagging skin are all tightening up with this product. And this is a really well established effective GHK copper peptide. And that's the number one reason people use it in the anti-aging world. I have concerns about the injectable form. The injectable form carries a fair amount of copper into the body. The beauty of the patches is there's no copper coming in. It just uses your body's own copper, which I like to help people optimize their diet so they're getting enough of it. But it's a really fantastic treatment that I recommend to all my patients because beyond just the skin, hair, and nails, GHKCU is perhaps our most potent anti-aging peptide, period. It was found in a genome-wide association study from the Broad Institute long ago when it was discovered to be the top pick of all the genome products that they could determine for the treatment of metastatic colon cancer. It's been shown to improve lung function in people with COPD. It's been shown to improve connective tissue all over the body. I mean, there's so many studies on this. There's so much data on it about the benefits of GHKCU. So I wind up using it in every single patient. And the other thing I've found in women who are dealing with hormone imbalances is that it is probably pound for pound my most effective treatment for them. And I want to unpack that a little bit, if I may. So, number one, almost universally, women who are struggling with aging and hormone levels and imbalances have fatigue. It's the number one complaint I hear. The number one thing I hear from people on the patches is they have more energy. Mm-hmm. The next thing they're struggling with is their mood is up or their mood is down. They're anxious. They're 1 minute they're happy, 1 minute they're sad. They feel like they're losing their stability in terms of their mentality and their thinking. Or they're losing other elements of their cognition. They can't focus. They can't remember things. They're forgetting where their keys are. They're forgetting appointments. It's very distressing. It's very frustrating. Many women report to me that they're concerned that they may be getting early dementia. Absolutely. And I've seen patients have their memories come back to their youthful state from using this product. I've seen them have their moods stabilize, seen them go from anxious panic attacks in and out of the hospital to no more panic attacks, no more medications for their panic attacks. The next thing I would say is sleep. And people tend to report that they sleep much more deeply on the patches. Someone told me that a patient of mine told me she had the most restful night's sleep she'd ever had on the patches the first night she wore them.
Wow.
And yeah,
that's huge. That's huge. That's such a huge complaint that I hear from everyone. So
yes.
Even together, wow, that's amazing.
Yeah. And then, the other thing I would say is that women often report to me that they feel like their hormones are just more balanced. Mm-hmm. And that gets into so many different symptoms. I mean, hot flashes, night sweats, breast tenderness, pelvic pain, period cramping. I mean, pain, GHKCU for pain is incredible. Lots of data and lots of reports and cases where someone's pain has substantially resolved just from using the X39 patch because it upregulates GHKCU.
That's absolutely incredible. And I know that LifeWave has different patches. This is like their most important one, mm-hmm. or the most popular one. Are mm-hmm. there any other patches that can possibly help ladies going through menopause?
Absolutely.
Combination with this.
I'll tell you what let me give you sort of the overview of trying the patches because I care very much about this. You get the occasional person who's what we call a one patch wonder. You put a patch on them and you see something incredible. Mm-hmm. I've seen stories, legs with edema like this. Suddenly the edema shrinks and their legs are normal in a matter of days. I've heard stories of people with some kind of, neurodegenerative issue, like their brain is going. They were on the couch having to have their family take care of them completely. All of a sudden they're up and cooking breakfast again. So you get these one patch wonders. That's by no means the typical experience. And so what I tell women, particularly as they're getting older, is plan on using the X39 patch for 1 month for every decade of life. Mm-hmm. So if you're 50, plan on 5 months of patches. If you're 60, plan on another extra month, right? Mm-hmm. And that's to give your body enough time to respond to the patches. I cover the rest of what I really think is essential to respond to the patches in that post I mentioned earlier, the 14-day reset, it really shouldn't be 14 days. I made it 14 days because that's enough to work to get people to change their behavior, but not enough to overwhelm them to say no. Because if you want to get all the value out of the patch, and the way to think about it is this, right? If you shine sun on a bare patch of ground, nothing happens. It just dries out the ground. You have to have something on the ground, like seeds, grass, some kind of plant, to capture the sunlight to use it. Your body is not actually any different. You need nutrients, you need vitamins, minerals, things like that, hydration, water to capture the energy of the patch and make it work. Overwhelmingly, in the people who don't get the results they want with the patches, I see that there is a massive problem with their diet, their lifestyle, their environment, something that's really easy to spot. Most of it's in that reset. So I like to tell people to prepare for that duration of a trial period, because the last thing I want is for someone who's going to have amazing results at month 6 to quit at month 5, because they're really missing out then. So I like to tell people to, whatever they're going to do and whatever they're ready to budget for this product, is just try and use as many months of the X39 LifeWave patch. My favorite story to tell about this is my own mother, who's 81 this year. She turned 81 last month. And she, last fall, tried to get off, or was using the patches and said, honey, I really believe in everything you do. And I'm not really sure what these patches are doing for me. I'm going to take a break. And I said, Mom, that's fine. I totally understand. We all have to clean up the credit card statement every once in a while, or it just gets way out of hand. But just take a week off and tell me what happens.
Yeah.
And she texted me back a week later and said, I can't believe it. Over a week, my depression, severe back pain came back. I wasn't able to go out and swim in the pool. I wasn't able to walk. I didn't want to leave the house. I was just turning into, not her words, but mine, kind of a mopey, miserable old lady.
Wow.
And she put the patches back on, and 2 days later, everything's better. Everything's back to where she was. So she didn't realize that over several months, she had this really profound impact, right? She used the X39 and the X49 combo. The X39 we've just been talking about with GHKCU. The X49 is related. It upregulates AHKCU. It's most active on brain and bone and muscle. And so women tend to report that they get better muscle definition. They put on muscle mass easier. I've noticed that myself as a man. Yeah. So it's easier to get and stay in shape with the X49, and people have more energy. And then the next patch my mother tried was the Silent Nights, which gave her an 80% improvement in her sleep. She went from waking up multiple times a night, struggling to go back to sleep, to being able to, when she didn't sleep through the night, if she woke up, she would quickly go back to sleep. So that was a really incredible improvement for her, and one that had evaded her or eluded her despite having all kinds of great, doctors and different things like supplements, drugs, etc. So my mother saw a huge impact with that. Those are the two that are, or three that are my favorite in menopause. The rest of them I recommend on a case-by-case basis. I will mention the IceWave patch is incredible for pain. I mean, we've had people go from 8 out of 10 pain with, say, like a meniscus tear in their knee to a 1 or 2 out of 10. That means going from being unable to sleep and move to being able to sleep through the night, which then allows the whole healing process to really proceed. So the first thing I say when someone's got pain is you have to try the IceWave patch. I like to put it with the X39, and the reason being that the IceWave patch is a tire patch. It reduces pain, and that's wonderful, but it isn't a root cause solution. We really want to use the X39 to get to the root cause. And one of the reasons why I'm so impressed by the X39 is that we routinely will hear people say, and this is paradoxical for some people, so bear with me, that they used the patches and their pain got worse. That's the body's inflammatory response firing up and actually going into the tissue and starting to really fix and repair things. The fact that people have chronic pain for years and years and years at a low level, it's like there's a fire. And so it's smoldering and smoking a little bit. And as soon as you turn on the water hose, it starts to smoke a lot. Why? Because there's more water. It's being emitted as more steam. And so we see that. And then if in a matter of months, those people generally have all that pain that was increased, then disappear, so long as they're sticking with the program.
Wow, that's absolutely amazing. So this is something that you actually want to be on for the rest of your life, pretty much.
Yes, we are absolutely planning on that. My
Yeah.
family, my patients, and I. I'm very, I sometimes joke with people that if I put them all on everything that's good for them, they won't have time to take anything but supplements all day. I'm
Yeah.
very selective with what I recommend to people indefinitely.
Yeah.
And as a matter of course, these products are so good that I just see such profound results, especially as people use them for longer. And I've also been impressed by how poorly people uh, do. And I don't want to say when they don't use them because it's not as though you can't get better or have a good quality of life without them. But it's so consistent that patients say to me what my mother did, which is, I tried to clean up my credit card bill and cut the patches, but I just can't explain it. I didn't feel as well. I didn't feel as strong. I didn't feel as vibrant. I didn't sleep as well. Something about the patches is so valuable to people that they remain customers for long, long periods of time. And for me as a physician, this is just a simple matter of, is this tool worth having in your toolbox?
Yeah.
Even if you're not going to use it every day. If you were my patient and you said, well, Dr. Stillman, it's not worth it to me to have a sleeve of X39s and ice waves in my medicine cabinet, I would say, are you out of your mind? You could get hit by a bus tomorrow. You could fall down and crack your head or really severely injure I had a case last fall of a woman who fell down, fractured her elbow, and she went 6 weeks with this thing not healing, and she was losing range of motion. She had something like 45% of her range of motion. She put the patches on, and 4 days later, it had gone from 40 or 50% range of motion to 80 or 90% range of motion. And within a matter of weeks, finally, this fracture that hadn't been healing was suddenly resolved. So I see that and I think everyone needs to have this,
Yeah.
even if you don't use it every day for the rest of your life. It's such a powerful tool. And whenever someone comes into my office in the practice with a problem, the patches are a part of the recommendation.
Yeah.
And if, for example, they've been battling it for a long time, or they're working with us and they still haven't seen results, often one of the things I'll ask is, are you still using the patches? And if so, which patches are you using and how often? And, there's a reason for that. We see them delivering these results very consistently. And so we really prefer that patients be on them because our whole goal is to really deliver as much value as possible. And
Yeah.
so we have a very short list of products and supplements we work with because we know people have a limited amount of bandwidth and we have to pick the interventions that are the highest impact, or we're not going to keep our patients and they're not going to send us their friends and family. And we do generally operate primarily by referral from current and past patients.
Sounds amazing, Dr. Stillman. If somebody wanted to reach out to you and get your 40-day reset program or contact
Yes.
you for consultation, how can they find you?
The best place to schedule a consultation is stillmanmd.com. And if they want to learn more about the 14-day reset, the place to go is my Substack blog. So this address is stillmanmd.substack.com. And if you just put that in your browser, it'll bring up the
We'll
Substack
link
and
it
go
below
to.
as well. I will put in the description so they can find
Thank you.
you.
Yeah. And if you could include a link straight to it, that would be great.
Absolutely.
But you should be able to find it if you just search for that.
Okay, wonderful. Thank you so much, Dr. Stillman. That was so helpful and hopefully will help lots of ladies out there who are struggling at the moment.
Thank you for having me. It's
Thank
been
you
great
very
chatting with
much.
you.
Thank you so much.